Hello, I'm Cindy Sharp with TRTA TV, and today we have a very special segment for you. We're going to be discussing the upcoming Texas Legislative session and our agenda here at TRTA. So we'll be visiting with our Executive Director, Tim Lee, Ronnie Jung, who is the former Executive Director of TRS, and also Bill Barnes, a retired school teacher, and also the Legislative Coordinator for TRTA. Now, you're going to receive a lot of information in this video. If at any time you would like to skip ahead, you can click on one of the links below and you'll be able to do that. So with all of that said, we'll go ahead and get started. Tim, can you tell us what is the most important thing that retired teachers need to know about for this upcoming legislative session?
Thank you, Cindy, very much, and thank you for everybody for watching and for being a TRTA member. And if you're interested in joining TRTA, I know we have links for you to be able to do that as well. I'd say the most important thing for our members to know in this coming legislative session is it's time. Here we are at the start of the legislative session. We've been doing a lot of behind-the-scenes work with our locals, meeting with legislators and talking to staff and preparing for this next 140 days. It'll start in January. We've got some big issues, and I know we're going to talk about a lot of those issues during this discussion. You know, health insurance is right at the top of the list. Defending what we've earned with our defined benefit plan, our traditional retirement system. So we have specific issues. But if I were to have an opportunity to talk to all of our members, I would say the most important thing right now is to be encouraged, to be ready for the fight that is coming, to know that we've got a significant role that we're going to play, and that ultimately we intend to win, that we are going to defend what we have earned. We're going to find solutions to these problems, and that we're going to be ready to do what we need to do.
Now, Bill, from your perspective as a retired school teacher, what do you think that our retirees need to be most aware of for the coming session?
I have had recently, I've been speaking at quite a number of local unit meetings, and what I'm hearing is they're very concerned about their health care. That's a biggie, and we talk about that. They're very appreciative of what happened in the last session on Senate Bill 1458, and so that's good. And the other part of it is, I think that our retirees are more than willing to get involved in the process and contact their legislators about our issues, and I think that's key, and that's where we need to focus for right now, is getting our membership involved now before session starts, to let these elected officials understand our concerns.
And then Ronnie, you have a unique perspective as well. As the former executive director of TRS, Teacher Retirement System, the state agency, what can you share with retirees to let them know what to expect for the coming session?
Well, I think it's important that they get involved and become active. We've done a lot of work for the last few years on TRS Care, for example, laying the groundwork, but now is the crunch time where critical decisions are going to be made in the next 140 days. So it's important that we get our voices heard and get the input, because while the legislature, we have a lot of new players, so education will be a key part of that process. And obviously the TRTA team will be very active in working, explaining the situation. But I think it's incumbent upon all of our members to let their legislators know about their needs and concerns, and really to make sure that they understand that having a reasonable health care system plan that's affordable is critical to their well-being. And I don't think anybody could argue that career employees are not entitled to be able to live their retirement out gracefully with reasonable health care benefits. So that's the message I think needs to get out quickly, because all the decisions are going to be made in the next 140 days. So now is the crunch time to get things done.
Well, Tim, you touched on some of the issues that are going to be discussed during the legislative session. So let's give a list of those to our members and let them know what some of the priorities are that TRTA will be focusing on for them in 2015.
Yeah, great question. Our members are aware probably the most serious issue that we're going to have in the coming legislative session will be the Teacher Retirement System health insurance program called TRS Care. We have a known shortfall that exceeds $700 million. Right now, it's hard to know exactly how much it is, but the last report, it was somewhere between $730 million and give or take a few $1 million. But that shortfall is real. It creates a real threat to our health insurance program. at the end of the legislative session, if nothing gets done to shore up the situation, there are very few options that are available to the teacher retirement system that manages the health insurance program. Really, the only two options that I'm aware of are to raise premiums to cover the amount of the shortfall, to cut benefits, and I guess the third option, which I didn't mention and will now, is to do both. To cut the benefits and raise premiums to make up for the shortfall. So those premium increases could exceed 100%. Benefits could be reduced by an immeasurable amount. It could very well be the draconian cuts that people often refer to when you have this kind of massive shortfall in the health insurance program. So it's a real important topic. It's probably the most important topic that we'll be dealing with this session. There are always questions about what else is on the TRTA legislative agenda. We will always and forever defend the traditional retirement system, the defined benefit plan. There will always be critics that will say this program doesn't work, we've got to get rid of it, it's not properly funded. We addressed a lot of that last session. And most of the legislators that we've talked to, they're proud of the work that was done. The TRTA partnered with the actives and with the legislature, school administrators. We all came together and we solved a problem that, for all intents and purposes, wasn't a major problem in Texas. For us, it was an opportunity just to make things better, and we did. The important thing will be to safeguard the work that was done last session so that somebody doesn't say, well, we have a health insurance crisis on one hand, and we shored up the pension fund last time. Maybe we should divert those dollars away from what we did in the pension system if it's gotten better and take those dollars away and put them towards health care. You don't solve one problem by creating another. And so we have to protect our defined benefit plan. We have to protect what we've already achieved in the previous sessions and work with the legislature to come with a real solution for the health insurance program. Bill, what else do you have to add on this?
I agree. I think we met the challenge, and Tim, I would just say that our legislators were well informed about our issues last time, and they really, truly wanted to help and solve that problem, be a partner with us to solve that problem. So I was very proud that we were able to work in that collaborative way. And I feel good that we can work in that collaborative way again to solve the problem. The meetings that I've attended at the Capitol, the State Affairs Committee meeting, and those meetings, it was very evident to me that those senators and legislators are looking for solutions. And the other piece of that I would say to our membership is that TRTA has been brought to the table to discuss this. And I think that's a real healthy atmosphere that we have helped create, and a relationship that we have created with our elected officials to bring us to the table to solve the problem, to come up with solutions, and resolve, hopefully, what will be a good outcome for us at the end of this session.
Ronnie, kind of thinking about the general overview of the health insurance circumstance or the situation, I know TRS did a sustainability study, and without getting into all the details of exactly what's going on with this sustainability study, we look at this health insurance situation. The way I sort of perceive it is we have an immediate crisis that could sort of blow up on us September 1st of next year if we don't come up with some budget dollars. But on the backside of that, we also have several out years of trying to come up with a better solution to funding healthcare in general. Is that a fair way of kind of looking at this problem?
Yeah, I think the issue is we have a short-term solution to trying to get by for the next 2 years, which is how the legislature looks at things. They fund for 2 years. But we really need to look at the long term. We can't be coming back in 2 years from now and asking for another $1 billion. So, if we fix the problem just for 2 years, it'll be a continued problem. Last session, we worked on long-term solutions for the pension fund. This session, we need to work on long-term solutions. We need to get by the next 2 sessions, but we have to make sure we have a health care program that's there for the current retirees and future retirees. That's going to require more money and more effort, and there's no silver bullet. So I think the key is we got to make sure we get enough money so retirees don't bear the brunt of all the increases. But we also have to look for long-term solutions, and those are not easy in healthcare because it's hard to project long-term healthcare costs.
Sydney, thinking about the question you asked earlier about the most important thing, I think it's important for us to understand that we have to work to educate these legislators on what some of these problems are, the scope, the magnitude of these problems. Like Ronnie said, it's easy for us in the legislative cycle to think of, we've got to get by for the biennium. And the healthcare situation really had sort of a 10-year funding solution, 12 years ago. And I say that purposefully because we actually expected TRS Care to run out of money last session. And so it was sort of a 10-year window of time that we had. And I think back in 2003, when it was really developed, there was a lot of expectation that we would have been needing to deal with this sooner. And so here we are a couple of years later, to the benefit of our retirees, but also to the credit of the legislature and to the retirement system for managing this health insurance program. But clearly, we've got a short-term crisis. We have a long-term problem that needs to be resolved, and it won't completely dominate everything that the legislature wants to talk about with TRS. There will always be other items that will come up, and we'll be communicating all of those issues. Somebody may want to talk about benefit increases for retirees. Somebody may want to talk about managing the system differently, or talking about the investment structure. We may have federal issues that come up that don't necessarily reflect the state legislature, but will involve our members during the same period of time on something going on in Congress. And so we always have a broad legislative agenda, and it's a busy time of the year. But clearly, with the scope of the problem that we have with healthcare, that'll dominate the agenda, but it does not say that we'll not have time for anything else.
Now, as y'all have been talking about this, it came to mind that I get a lot of phone calls from members that are not as familiar with the trajectory of TRS Care and how this crisis came to be. What can they say to their legislator about this crisis and how it occurred, and how can they understand it from their perspective? Why is TRS Care in the situation that it is in today?
Well, it's a great question, and I'm going to throw this back to Ronnie in just a minute. But the general overview that I have is that we knew this moment would come. I don't know that anybody could say it's because of what's been going on at the federal level with the Affordable Care Act. That there doesn't seem to be one singular issue that the nation may be focused on right now that has created this moment in time for TRS Care. We have various funding sources that we utilize to pay for the cost of TRS health insurance, and those funding sources simply have not been able to keep up with the cost of the program. We've had more retirees. We've got folks that are living longer, thank goodness, that we have the quality of life that we do under TRS. And those funding sources, in a lot of ways, are based on how much money active teachers are getting paid. Bill and I sometimes go out and joke with our local members and say that if the legislature would just give all of our active teachers a 50% raise, I don't know if we would have this problem with health insurance. We'd have a lot more money coming in for TRS Care. I don't know that that's going to be realistic. So we're gonna have to work on some solutions that may talk about increasing those funding sources. But Ronnie, what have I missed, or what do you think else?
Well, I think the real problem is, as you mentioned, we have more and more retirees, and healthcare costs are going up. And the average age of our retiree population is around 70. So prescription drug costs, for example, are going up. So the problem we have is that the funding structure, which is a percentage of payroll, isn't tied to the fact that we have more retirees and more healthcare costs. So somebody has to pay them. TRS has really done a good job of trying to control the cost. They've done Medicare Advantages. They bid out the prescription drug. But the bottom line is, to have quality health care, somebody has to pay for it. And because of the fact that we had built up $800 million a few years ago, the legislature actually reduced funding one year just from 1% to 0.5%. But the bottom line is, we're eating up all that balance. And when you run out of money, then it costs a lot more. So we just kicked the can down the road in dealing with this problem. And we tried to address it last session, but it became clear during the session that we could only deal with pension funds. And knowing with the new accounting rules, we're glad we did, because we fixed it. And so now it's time to deal with healthcare. So the fact that 10 years ago we knew it was going to be a problem, We've extended it 12 to 14 years, is great, but we still have to deal with the underlying problem that there's more and more retirees and somebody has to pay. And so that's where our funding structure, I think, has not been adequate. I think it's really small. If you look at what the state pays on average for a retiree, it's probably just a little over $100 a month and $120 a month. That doesn't go very far when you have more and more retirees and the costs are significantly higher. So we need more funding for the program, the bottom line. And I think the state and the districts have got a bargain for the last 25 years with the low percentage, but now it's time to start paying a reasonable cost.
So when you talk about this funding structure, for somebody who may not be familiar with that terminology, what does that mean when they are taking a percentage of payroll? Can you explain that in some simple terms for our members? Yes,
the public school, just as a pension fund, is funded on a percentage of payroll. My daughter is a teacher. If she makes $40,000, the state would pay us 1% of that a year, so we would get $400 for that payroll. So when payroll goes up it was flat one year. So the money we got the next year based on the 1% payroll was the same dollar amount when there was no payroll increase. But we had probably 5 to 10% more retirees and 5%. So the bottom line is a percentage of payroll works if you have payroll growing a lot and it correlates with increased costs like the pension does, because pension benefits are tied to payroll. But healthcare costs are not tied to the payroll. So when payroll goes up 4 or 5%, but we have more increase in retirees than that, then who's going to pay for the increase in healthcare costs? So the percentage of payroll is works for the pension fund, but not for healthcare.
Now, Bill, I hear from a lot of our members here at TRTA that they're very concerned about this crisis. Give us some feedback on what you're hearing when you go out and speak at local units. What are members most concerned about?
I've spoken at quite a number of local unit meetings this fall, and there seems to be a common thread of their questions. You know, I can almost guarantee you what the question is going to be. And there are no solutions right now. There are no absolutes, I would say. You know, there's no guarantee. Healthcare is not a guaranteed benefit, and I think that's something that I tried to emphasize to our members. That, you know, I'm a retiree. I'm very blessed to have my health care. I value my health care. So, but what I'm hearing from a lot of retirees is that same thing. You know, they're glad to have health care. They feel good about that. Their costs are going up. Their out-of-pocket expenses are going up.
And when they come to you and say, Bill, what can I do? How can I help resolve this situation? What do you say to them?
I'm glad you asked that question. Recently, I was at a meeting, and there were several legislators there. And so that question came up, you know, what can we do? And I, you know, it's just real easy. Well, number one is you have to contact your legislator. You have to get to know your legislator. They're really friends. They're ready to help us. They need to know what your story is, how it impacts you. Recently, I was at a meeting, and this lady said, we were talking about the cost of prescription drugs, you know, going way up, and she said, but you know, the drug that I have cancer, and the drug I have to have is very expensive, and I'm very grateful that I have a prescription drug part of my healthcare program to help offset some of those expenses that I'm out, but I'm still out a lot of money each month, copay, you know, or copays or out-of-pocket expenses. So, you know, my answer to that is tell your story to your legislator. This is the way you get them to understand how it directly impacts you. I'm blessed. I have pretty good health care. You know, my health is, I take a little medicine, but I know there are people that think I should take a lot more medicine, but these people that I have a very good friend, it is very important for her to have her medicines every month, and it's a life or death situation for her, and it's just costly. Those are the drugs that are the most expensive, but that's where the cost is coming in for those drugs. I don't have any control over those drugs, the cost of it, but I do have control of saying to my doctor and to my legislator, these are my concerns. This is, important to me. Our members need to make it important to their legislator.
I know. If I can add on to that,
Sure.
I get asked that question all the time. I'm talking to locals, and I see thousands of our members on a regular basis in the locals, and that's the number one question that's asked as soon as we're done talking about the situation is, what can I do? I'd say the first thing that you can do is say, I'm committed to making a difference. A phone call, an email, signing up for our inside line, something that allows the legislature, your legislator specifically, to hear from you. Cindy, as you know, we've just finished and our members are starting to receive the last issue, the fourth quarter issue of our news bulletin. And page 3 of that news bulletin has a short message from TRTA with a space right below that for our members to write a short letter. On the back side of that page, page 4, are some facts and figures, charts, things that legislators need to know. And so being involved early is going to be a huge difference maker for us. So we probably send out close to 90,000 bulletins. We have over 80,000 members. If we would have, even a 10 to 15% response of our members committed to filling out that form and mailing it back to us so that we can hand deliver those messages, it'll be a huge difference maker as we start this legislative session. I cannot overstate the importance of our members being involved with this legislative session just through communication, a phone call. Remember the key parts of communication. We want to be nice. We want to be helpful. We want to be encouraging about coming up with a realistic solution. We are not that kind of organization that gets angry with legislators or yells at them. I just don't know that that's very constructive communication. Most of the time, if I'm getting yelled at about something, I probably am going to get defensive. These legislators are just like us. They're elected to do a job. They're elected to represent our members, and we need to make sure that they know what we want and how to solve these problems. But it's going to start with people deciding that they want to be involved. I would encourage everybody to be involved in the local unit. We've got a lot of folks who are going to watch this who may not be involved in the local unit, and I'd say find your local unit, get on a legislative team there, and be ready to help. I looked at folks right in the eye yesterday at meetings, and I talked to them about how much of a percentage increase is going to potentially occur if we don't resolve the situation legislatively, and there seemed to be a lot of shock that it could be that bad. I'm here to tell you, if we don't come up with a solution together, it may be that bad. And so we've got this opportunity to stay involved, and involvement means that I'm just willing to from home. It's not that you have to drive to Austin or you have to travel to the Capitol. Pick up that phone. We have a toll-free number that you can call your legislator. The operator will ask who you want to speak to, and you can tell them who your legislator will be. They'll transfer you. Certainly can use our service with the inside line to send emails. So I think those are the important things for our members: is to be visible, to do what they do best, and they've done all their lives, and that's to be ready to educate, and not to give up on any of our potential legislative students, and make a difference in this legislative session.
I want to know, what final thoughts do you have to share about the upcoming legislative session?
I would say that I'm excited. It's going to be a challenge. I want our members to be energized. I think they are. I think they are committed to doing this. There's nothing wrong with our TRS Care. TRS Pension Fund. Our care needs more funding. We're ready to move in that direction to support that. I think our communication with our legislators is strong. I think our message needs to be stronger and to get it out there to them. And I'm really looking forward to the challenge.
What about you, Ronnie?
Well, I think our biggest challenge in TRS Care is going to be the fact that first we have to overcome the issue that we have a crisis. It's not a crisis in that something just developed for mismanagement. So we have to overcome the fact that the whole system was designed to run out of money. We run out of money, we have to deal with it. Once we get past that, I think then we can focus on solutions. And I think that's where our membership really needs to be involved in coming up with solutions that are fair and beneficial to the members rather than just to the taxpayers in general. I think we have to make sure we have to fight for solutions that help the retirees and are fair. And so I think the solution part is where we can really get involved and make our voices known.
Yeah, Bill, I'd agree that there is nothing wrong with our TRS Care. I think it's a good benefit. I think it's just underfunded. There's not been any mismanagement. There's not been any immediate sense of crisis. As Ronnie said, that something's been wrong. We've just exhausted our revenue, and we have to work with the legislature to come up with better revenue sources. As far as my concluding thoughts, I would say to everybody, the legislative process at times is a sprint. At times it's a marathon. It's a roller coaster. There are ups, there are downs. I'd just say from day one until day 140, we have to know that it will be our membership that will make the most significant difference for our TRS Care program, for our pension fund, that we're in it together, and that we've got to do it. It's up to us. As we talked about earlier in the video, TRS cannot advocate. The active school employees have significant challenges that we support them on, but we know that they've got to deal with some of their challenges as well. And so we need to lead. We need to be committed and to lead on this issue and defend what we've earned, work with the legislature, continue to educate them in a positive way, and broaden our appeal to them as a group that works with them to solve problems, because that's what we do.
Thank you, Tim. And thank you, members, for joining us today. If you would like some additional information on how you can get involved and help to resolve the crisis for TRS Care, please visit our website, which is www.trta.org. There are numerous resources on the website available for you, including training guides and also the ability to sign up for the Inside Line. And we will be using the Inside Line throughout the legislative session to provide you with information and also action alerts so that you can contact your legislator. Please also be sure to like us on Facebook, and please feel free to call us at TRTA with your questions and concerns. Thank you again, and have a wonderful day.